as part of your protocol, your doctor has prescribed you hCG 5,000 unit injection. You will have picked up your hCG from the Markham Fertility Dispensary. It comes in a box that looks something like this. Inside the box, you'll see that there's 2 vials. One is a liquid vial, the diluent. One is a powder vial that has the white powder in it, the medicine. You'll also receive some injection supplies. You'll need a 3 ml syringe with the 1.5 inch needle, a smaller needle tip, and an alcohol swab. When you're ready to do your injection, you'll start by opening the larger needle. First, you'll twist to make sure that the needle tip is on tightly to the syringe. You'll take the plastic covers off of the vials and use your alcohol swab to clean the top of both vials. You'll take the cap off of your needle and pull back some air into that syringe. And then you'll start by injecting into the vial of diluent, into the liquid vial. You'll turn that upside down, push in the air, and then you'll pull back 2 mils of fluid into this vial, making sure that your needle tip is in the liquid at the top. And you'll go all the way back until there's 2 mils of fluid in that syringe. And then you'll pull that out and then inject that fluid into the white powder. So you'll push it into this vial, swirl it around, and you'll notice that that white powder dissolves almost instantly and you're left with a clear fluid again. Make sure that you set your diluent vial out of the way so you're only working with the vial that actually has the medicine in it now. If you're doing an intramuscular injection for your hCG 5,000, at this point, you'll turn the vial upside down and draw back on your syringe, keeping the needle tip inside the fluid to 1 mil. And then you'll pull that off and you'll make sure that there's no big air bubbles inside the syringe. You can pull it back, make sure that all of the air is kind of up at the top, and then slowly push the plunger up until you see a bleb of fluid come out the top and your plunger is at the 1 mil mark. If your doctor has prescribed this injection subcutaneously, then at this point, you'll pull back on the syringe. So there's air at the top. You'll put the cap back on that intramuscular needle, twist that off, and put on your subcutaneous needle tip. Take the cap off, and now we're going to push this back up. So the fluid is going back to the top, and push until you see the bleb of fluid at the top of the needle tip, and your plunger is at 1 mil. Now you're ready for an hCG 5,000 unit subcutaneous injection. Now that you have your medication prepared, here's a video on how to perform a subcutaneous injection. First, these injections are going to go into your abdomen. So you'll pick a spot 2 fingers away from your belly button and inject anywhere in your tummy. The injection is going into that fatty layer of tissue right under the skin. So 2 fingers away, anywhere in your tummy, just like this. When you're doing your injections, you'll pick a spot and then you'll rotate your sites. So try not to poke into exactly the same spot as you did already today or yesterday. Try to rotate the spots a little bit, even a finger away is helpful. When you're ready, you'll use an alcohol swab to clean the area that you're going to inject into. And then you'll give that a few seconds to dry. You'll take the cap off of your prepared needle and pinch your skin where you're going to do the injection. You'll inject at 90 degrees all the way in. Push the plunger on the syringe down until all of the medication has been delivered. Then you can relax your skin and pull out the needle. A little bit of blood, a little bit of liquid might come out. That's okay, it's normal. You can use a tissue to hold the spot until the bleeding stops. And then when you're done, make sure that you put your used needle into a sharps container or your medical waste bag.